Sleep apnea is where we can lay down and our musculature relaxes, and the tongue can fall back and cause an obstruction within the airway. And what that does, some of the symptoms of that, it might be you wake up and you just don't feel rested, or maybe you snore pretty heavily at night. Now, not all snorers have sleep apnea, but almost every person that has a sleep apnea problem snores. But you might wake up and not feel rested. You might, if you're ever in the night and wake up startled, you probably have sleep apnea. And the process in the past has been using the CPAP, or the machine that the mask that fits over your face and gives positive air pressure throughout the night. We, over the last few years, have developed, it's FDA approved, an appliance that can be fabricated for you that actually opens the mouth and brings the jaw slightly forward to open or to release that obstruction, so you can sleep better at night, you stop your snoring. And we now realize more and more about the health effects, the problems with sleep apnea: higher blood pressure, higher increased probability of stroke, heart disease, and others to mention. And so with this appliance, we're able to help manage that sleep apnea. Depending on your severity, what we do is we have a company that we work with. We're able to order a sleep study where it's brought to your home. You can have the sleep study done. It's read by a board-certified sleep specialist. And then through that process, decide if you're a candidate for one of these appliances. If you're moderate to mild to moderate sleep apnea, you have a great prognosis for the sleep apnea appliance to work. Many times people go into CPAP, the positive pressure machine, and they can't tolerate it. Well, if you're intolerant or you're not able to use that CPAP, many times we can fabricate this appliance that can help you, at least get you past that part. The important thing is to get a restful night's sleep, where you get into that reparative sleep where your body heals, your blood pressure goes down, you have less chance of stroking, and just lead a much healthier life. The appliance is made, there's an upper appliance and then there's a lower appliance, and they're placed in at night. We discover where the best opening and the best place to put your lower jaw, and then we design the appliance to hold your jaw into that position throughout the night. So it is something that you take in and out, and they work great.